Newborn screening, information for parents. Newborn screening is a test for new babies that can identify rare but serious medical conditions. A small number of newborns each year will be affected by one of these rare conditions, but a newborn screening test can pick it up early, allowing doctors to treat or manage the condition. Babies affected by one of these conditions look healthy at birth, but they can become sick very quickly. Newborn screening is the only way to identify these babies early before they show symptoms. The screening test is free and requires a small amount of blood to be collected from the heel, 48 to 72 hours after birth. This blood is collected onto a newborn screening card by a midwife and sent to the screening laboratory at the Royal Children's Hospital in Melbourne. The sample is tested for a range of different chemicals or metabolites. Abnormal levels of these chemicals may indicate that a baby has a problem with their metabolism. Some of these conditions can be life-threatening. For most affected babies, though, early intervention by doctors will prevent intellectual disability and help them develop normally. Some of these conditions include phenylketonuria, congenital hypothyroidism, cystic fibrosis. After birth, parents will be asked to give written consent for their baby to have blood taken for newborn screening. Screening is highly recommended for all babies, but it is a voluntary test. Leftover blood samples from screening are stored indefinitely in Victoria, and they can be useful for population research on health problems that affect children, such as asthma and cerebral palsy. Parents have a choice as to whether their baby's sample can be used for this purpose. Newborn screening is about protecting the health of newborns. Deciding to make the sample available for research use is a personal preference and should not affect the decision about screening. Given that most babies will have normal results, parents are not usually contacted. Sometimes a repeat blood sample may be needed. This can happen for a number of reasons, but most of these repeat tests will give a normal result. If a baby is found to have one of these conditions, parents will be referred to a specialist. Further information is available about both the newborn screening test and about the possible research use of samples. Given the awkward timing of newborn screening, which needs to occur shortly after birth, it's a good idea to read up on the program during the antenatal period. For more information, parents can talk to a midwife or other health professional, ask for a newborn screening information brochure, or visit the newborn screening webpage.